Hello, good evening, and welcome to the Functional Solution podcast and class brought to you by the American Academy of Functional Health. My name is Tal. I'm the educational director, and with me we have Dr. Esha.
Good evening, everyone. Hey, Dr. Tall.
If you are here to explore the root causes and learn more about how to help your patients with chronic conditions, and walk away with practical evidence-informed tools that you can use in your practice, you are in the right place. So every week we focus on one specific condition or symptom that your patient might be struggling with, and we dive deeper into what would be the functional or integrative approach to address those. But today we are going to do things a little bit different, right, Dr. Esha?
That's right. That's right.
And so today we're going to talk about a really interesting topic, which is methylations, genetic, and personalized medicine. And the topic is, of course, the main focus is genetic, epigenetic, and what practitioners are missing when they are working with patients. And I wanted Dr. Esha to join us because Dr. Esha has years of experience as a both primary and functional and integrative medicine practitioner. So I wanted to hear her share her experience. How would we utilize this approach or integrate this approach? And of course, I'll share some clinical insights as well from my experience. And this is going to be interesting. I know that Dr. Esha, I'm going to start with a little interesting conversation that I had with a practitioner. So every day we have for the programs in the academy, there's practitioners that are calling, or our team is they ask for more information. Our team is reaching out, and a lot of them are nurses, nurse practitioners, physicians, pharmacists, kind of a variety of professionals. And my team reached out to me and said, there's a physician, and they've been trying to they're super interested in the programs, but they have this question that we just can't satisfy, right? And I said, okay, let's connect them with me and see what, and we'll have a conversation. And so I go on the phone with this physician, and a very nice guy, lots of experience in family medicine. And I asked him, we talked a little bit about his goals and why he's interested. And he said, listen, I'm interested in this, but I'm like, you keep saying the root cause, right? And I say, yeah, I mean, that's generally, it's generally what we focus in functional medicine, right? We look at what's causing the condition, what's contributing or triggering. And he said, but we already learned all that stuff in medical school. And I said, we're not taking away anything that you're learning. On the contrary, we're actually building on top of that, right? And he's like, so just explain to me why am I going to learn about the root causes? And I said, well, we're going to talk about what they didn't talk to you about in medical school. And he said, what is that? Because he's like, well, I already learned about the root causes, right? And I asked him, well, what's the root causes? Let's talk about it. Like, what's the root causes of like diabetes or a certain cardiovascular or autoimmune condition, right? And he said, well, it's genetic. And I said, and that was really interesting because the perception was that it's the our genetics, the gifts that we get from our parents, grandparents, whatever it is, that's what's causing it, right? And it was a really interesting conversation about really the difference between genetic and epigenetic, right? And so that's exactly what we're going to talk about today, which are what are the factors that could be that are leading, what are those epigenetic factors that lead to disease or dysfunction, and how is that different than genetics, right? So that's why I feel like it's such an important conversation to have, because there are a lot of practitioners who are doing amazing work with chronic patients, but it's that missing link, right? It's that missing step or phase or part of the care that can help your patients from keep on struggling with the same symptoms or condition to transition to a healthier function.
Right. Right. Yeah, I remember I had how I think of this. When you were mentioning the conversation you had a practitioner with. When I was in school, I had a teacher who was a physician, and he always described the difference as kind of like, the reason why epigenetics is important is you're kind of turning down the genetic dial, if you will, right? So the genes say, oh, you have a 60% chance of developing, I don't know, this disorder. If we're able to modify your diet, maybe we turn that down to 50. And if we're able to modify your environmental pictures, we turn it down to 40. So it was really cool how he was able to describe just the importance of epigenetics and being able to alter the expression of these pathways and these genes. So I'm really excited about our conversation tonight.
Yeah, absolutely. And of course, we're going to talk about some of the mechanisms, some of the interesting pathways, and we're also going to give you recommendations that are kind of specific on how to do this. But the idea is like, how can we get better clinical results with our patients? If you're watching this, you're probably in healthcare. You're probably here because you want to offer more solutions or better solutions or integrate other solutions into your practice and help your patients, right, in a more meaningful way. That's really why we're here. That's our passion and mission. And so this is really about individualized care, really taking a look at the different. We're going to talk about some methylation today. We're going to talk about some we're going to definitely give examples for what the difference between genetic and epigenetic are, and then we're going to take a look at some of these really interesting concepts when it comes to why does a patient develop type 2 diabetes, right? Or rheumatoid arthritis, or a cognitive decline, or Alzheimer's, right? Why do they develop that, right? And so the genetics are there, and we typically would know about the genetics, but we're going to go way beyond that. So let's get started with, first of all, understanding the differences, right? So this is a picture from the Journal of Oral Medicine and Dental Research. And we always try to pick the images. This was published in 2023. And we always try to get the images that are showing the information in the most simplified and kind of get the message real in a simplified and quick way. So you can see on the left side, genetics is the DNA sequences we all know from biology 101, right? The epigenetic is the expression of that DNA. And while our genetics, right, the DNA sequence is stable, it's the same, right? It's rarely reversible or resistant to change, right? The epigenetic impact is very, very dynamic, and essentially it responds to the signals from our environment. And when we say environment, that could be multiple things, right? But it is readily reversible. And while our genetic, there's impact on certain genes at time, our epigenetic can impact multiple genes at the same time. So just to give you an example, if your gut bacteria are shifting, or if you're exposed to a certain endocrine disruptor, that can impact multiple genes at the same time, right? Now, both of them, interestingly, your genetic and the way you react to certain environmental or internal factors is also heritable. However, while we cannot change our genes, right, not at least in a very experimental way, we can very quickly and effectively, and also in an affordable way, modify the expression of those genes, right, which is epigenetic. So we don't have control over our genes. Whatever we got as a gift, we got it already, and that's in each one of our cells. But what's turning on and off, right, and what's expressing or not expressing, the epigenetic of it, That we do control, all of us, with every decision we made in our life, right? In terms of our lifestyle, our diet, our supplements, our stress, our everything we're going to dive much more in depth into this. You are in control of what your body expresses, right? And it can go in either way. It can go in the direction of a healthy function or a dysfunction, right? So to summarize it, genetic refers to the information that is coded in your DNA. That's just a biological term, right? And it determines the basic physiological, biological traits like eye color, blood type, all of those. Epigenetic is the control system. So I mentioned before the analogy of a switch turns on or off, right? And that's essentially the chemical tags and regulatory signals that control how and when certain genes are turned on or off. Now, of course, these changes do not alter the DNA sequence itself. Instead, they just change how the genes are expressed. Now, I mentioned a few examples of how we are every day and throughout our day are impacting our epigenetics in our body, right? The food choices that you make have a very specific. Certain foods can turn on and off certain genes or impact the epigenetics. If you stress can negatively impact your epigenetics. Lack of sleep or lower quality of sleep can definitely impact on that. Exposure to environmental factors that unfortunately we're all exposed to. Early life experiences, traumas, drugs definitely interact and change our epigenetics. And then we have internal factors that we're going to talk about very in a few minutes that can make a very significant impact on our epigenetics. So think about epigenetic. Another way to think about it is epigenetic essentially is the software that tells your body which genes to run, when, and how strongly, right? What we refer to as upregulating a certain gene. So you as a practitioner, by guiding your patients, providing the appropriate guidance for their physiology, right? You can alter the function of their epigenetics, right? And by that, you are altering their, I'm going to choose a really big word here, but you can change their destiny by changing their epigenetics, right? And we've seen that. We've seen patients on an autoimmune condition, and within a month into it, they're in remission. They need less medications, right? We've seen patients with type 2 diabetes that no longer need metformin, right? We've seen patients that have changed the expression of these genes, and that's really a lot. That's really most of our focus in functional medicine. So, Dr. Esha, I know it's a big topic, but that's also why I wanted to bring Dr. Esha as a physician to kind of also explain more about these concepts.
Yeah, it's a really big topic. It's something that does warrant a little more in-depth studying, right? As a functional medicine practitioner, because so much of our patients' lives can be altered by working with their epigenetic picture. So it's really important, and it's really fascinating, like you mentioned, just dietary picture, foods that can alter the expression and stress and sleep patterns. So, our patients carry genetic variants that increase their risk for certain conditions or chronic diseases. Most patients, having these genes, it doesn't mean disease is inevitable. What truly matters is whether the genes are expressed or silent. So like Dr. Tall mentioned, upregulation of the genes also is included in that. And then this is where epigenetic mechanisms come into play. So let's take a look at this illustration from the Journal of Nutritional Biochemistry. This paper, they're synthesizing emerging research on how nutritional exposures early in life, even before birth, can shape long-term health outcomes. During fetal and early postnatal development, nutrients or nutrient deficiencies can actually modulate gene activity, through a process known as epigenetic programming. Essentially, these are chemical modifications to DNA or histone proteins that don't alter the genetic code, but influence how our genes are expressed, similar to like if you're dimming or brightening a light. So upregulating, downregulating. From a clinical perspective, these early epigenetic changes can alter key metabolic pathways, influencing insulin sensitivity, lipid metabolism, and appetite regulation. And over time, obviously, this can increase or decrease your patient's susceptibility to metabolic conditions like type 2 diabetes, obesity, cardiovascular disease. And in this article, particularly, if you wanted to, check into that article a little bit more, it's particularly valuable because it's actually integrating nutritional science, developmental biology, and epigenetics, offering this somewhat unified framework for understanding how these early life exposures can set the stage for lifelong metabolic health or dysfunction. So kind of like Dr. Tall mentioned, think of epigenetics as like the control panel for gene expression or the software. And through mechanisms like methylation, histone modification, and microRNA regulation, which may sound like big fancy words, but they're not necessarily. The body can determine through these processes which genes are turned on, which genes are silenced, and to what degree. Unlike your genetic code in that first picture we saw, which is fixed, epigenetic patterns are dynamic. They continuously respond to diet, toxin exposure, stress levels, inflammation, our patient's overall lifestyle. And this adaptability is what makes epigenetics such a powerful concept in functional and integrative medicine. So just thinking about a couple of different examples. Like type 2 diabetes, research shows that epigenetic changes in genes regulating insulin sensitivity and glucose metabolism, including our PPAR gamma and GLUT4, which are receptors, and also specific genes related to these pathways, they're strongly influenced by nutrition and environmental exposures, not just genetic inheritance. We think about cardiovascular disease. So similarly, hypermethylation, right? So overmethylation of lipid regulating genes such as your ABCA1 has been associated with the development and progression of atherosclerosis, even in individuals who don't have an inherited risk allele in their gene. So ABCA1 is a protein that acts as a cellular pump, moving the cholesterol and phospholipids out of the cells to be used in formation of your HDL, high density lipoproteins. So these are just two examples related to metabolic issues and how epigenetics can influence gene pathways. And so from a functional medicine perspective, these findings reinforce the idea that gene expression is modifiable and that targeted interventions in nutrition, lifestyle, and environment can meaningfully shift disease risk and obviously clinical outcomes. So, bottom line, your genes matter, but choices and environmental components actually shape how they behave, as we see in this picture. So let's do our first pop quiz. Which of the following lifestyle factors can influence epigenetic patterns? A, diet, B, toxin exposure, C, stress and inflammation, or D, all of the above. So I know everyone's going to get this right. Give you a few seconds. The correct answer is D, all of the above. So if you're interested in walking through your patient's kind of history and learning about methylation patterns, nutrient status, and how these actually influence detoxification, neurotransmitter balance, and immune regulation, again, log into your advanced and clinical functional medicine platform. You can also book a coaching call with us to review case studies and just learn how to offer functional medicine right away. It's a part of your program and does not cost extra to you. I know methylation can seem like an overwhelming topic, but there's some really good modules that are available in the program for you to learn more and take a deeper dive into methylation and how to look at it, how to assess, and how to help your patients through epigenetic methylation scenarios. So Dr. Tall.
Yeah, I'm glad you brought the example of the cardiovascular disease, and more specifically the lipid regulating gene, the ABCA1. Mm-hmm. So ABCA1 is really interesting. It's essentially the full name is ATP binding cassette transporter A1, which sounds really cool, like a Star Trek name from a Star Trek movie, right? But essentially what it is, it's the major function of it is to remove or support the process of removing of excess cholesterol and phospholipids from the cells. So, and it's really important. It's really important. It's also a key step in forming the high density lipoprotein, the HDL, which what we call the good cholesterol, right? So we definitely want this to be a properly functioning because it can help your patient to reduce the damage of cholesterol accumulation and also increase their HDL, which reduces which is very important in prevention of cardiovascular diseases, right?
Right. Be nice if, sorry.
Oh, yeah, go ahead.
I was just going to say, with cardiovascular disease being the number one cause of death, for the last however many, centuries, or decades, you would think that this would be a part of kind of standard cardiovascular, cardiometabolic picturing in medicine, right? The methylation, epigenetic picture. Unfortunately, it's not. So functional medicine is kind of where this really takes a shine.
Absolutely. And what they found in research is really interesting is that our diet and chronic inflammation are one of the major impacts on epigenetic impacts on such genes, right? Or the expression of those genes. So essentially, if your patient is coming to see you, and this is just a very oversimplified, of course, example, but if your patient is coming to see you and they struggle with low HDL or they're high cholesterol and they have statins and they have cholesterol risk, and we ignore their diet, or we ignore the fact that they have chronic systemic inflammation, essentially some of these genes might be still impaired, and that could unfortunately in the long term increase their risk, right, of developing complications. So this is really a big part of why when we talk about epigenetics, there are a lot of things you can do beyond the prescriptions to help your patients, and some of them are really affordable. So that's really the goal: how to keep our patients healthy and healthy for a long time, right? That's the biggest impact. So let's go into. So Dr. Esha mentioned methylation. So let's go into talk about what is methylation and what's methylation got to do with chronic diseases, right? So we're going to look at methylation from a genetic, or we're also going to look at methylation from more of an epigenetic, and we'll give example of how gut health, for example, or gut microbiome impact. So that's more of a functional medicine twist to methylation. But essentially, if you just remember one thing, is that methylation essentially in biochemistry is the process of regulating our detoxification, right? How we eliminate harmful compounds, right? Chemicals. Those could be external chemicals, and those could be internal, right? And so it's also involved in hormone metabolism and neurotransmitter synthesis, which is really important for our nervous system function. It's also important for DNA repair. So if your patient has impaired methylation, it could contribute to increased oxidative stress, inflammatory signals, and both of them are major drivers of chronic disease, right? So let's take a look at an image that we've created to better understand the process of methylation. For some of you who might not be have taken biology 101 for a long time, let's take a look at what is methylation. So methylation, I'm going to start with number one on the top left. So methylation is like adding a tiny tag called methyl group to your DNA. It doesn't really change your genes. So again, we're not, whatever we are born with, our genes is what we have. But it's what we do with them that really matters, right? So what methylation does, it really changes how active your genes are. And I really like Dr. Esha's analogy of like dimming, like you have a dimmer, right? You can dim the light down, or you could increase the light, right? You can make it brighter or less bright. So that's essentially what's happening in methylation. Now, why would that be matter? Why does that matter? Because many of the processes in our body involve methylation. So I already mentioned detoxification, DNA repair, which is really important, and the ATP production, like making energy, right? Regulating mood, neurotransmitters and hormones, all of that. Number 3, what happens when it goes wrong? So if methylation is too slow or too fast, it can lead to problems, right? So for example, if your cellular energy production is not working properly, your patient could be tired. They can have brain fog. They can have decline in memory, right? It can impact organ function, right? Like decline in kidney function, for example. Mood disorders, that's another possible outcome. Cardiovascular issues, inflammation or poor detoxification, right? And then number 4 is what affects it. So methylation depends on nutrients. So this is, again, I'm oversimplifying everything just for sake of our conversation, because this is like we have like a 3 or 4 hours class in the advanced program just on genetic testing and very specific epigenetic strategies that we can help once we get the testing results for the patient. But methylation essentially requires nutrients, so B12, folate, B6, zinc, magnesium, and then we got the other factors that are important to address. What's the level of stress of your patients? What's the toxic exposure? What the sleep looks like, right? What's their diet? All of those can play a role. And then the 5 is the big picture, which is healthy methylation means balanced gene expression, right? Not too fast, not too slow, just right? And that leads us to a good, right, energy production that fulfills the requirements of the body, of the cells, the organs. Stable mood, because you have more balanced neurotransmitters. You got a strong detox, a system that can allow the chemicals to be expelled out. And then you have what we call vibrant health, right? That's really the definition of vibrant health, is not just the lack of disease. It's actually healthy function, right? So that's essentially the explanation. Now, I did want to mention something sort of like a clinical pro tip when we talk about methylation, and that's one of the major indicator or possible indicators that your patient might have elevated issues with methylation, and that is elevated homocysteine. So homocysteine is very simple to test. LabCorp, Crest both have a blood test that you can order for homocysteine levels. But homocysteine is really interesting. It is not part of the primary care evaluation. And it's quite surprising that it still haven't, because there's so many studies that are showing that it is associated. Elevated levels are associated with increased risk for cardiovascular diseases, cognitive decline, dementia, thyroid, liver dysfunction, fibromyalgia, pregnancy complication, blood flow impairment. So all of those are associated with elevated homocysteine. And that essentially means that the body isn't efficiently remethylating homocysteine into methionine. And we're not going to get into homocysteine because that's a whole class by itself, but it could happen for multiple reasons. So one, everything we talked about that can impact methylation can impact the homocysteine process in the body, methylation of homocysteine, and even as simple as B9 deficiency. Maybe some patients have, for example, gene variants that they're not metabolizing B9, B12, or B6 properly. So even if they take sufficient amount in their food, right, or a multivitamin, they still might need a little bit more than others. Inflammation can impair the function of the enzyme. And then, so by now you already have a very fundamental understanding of what is methylation, what's homocysteine. And if you have a patient with cardiovascular condition or cognitive decline, I would definitely recommend to look at levels of homocysteine as one of those markers. There's other ways to look at that, but that's one of the markers. And then, because sometimes it can help, it can be very beneficial for the patient to know that, and then there are strategies to change that. And Dr. Esha is going to actually talk about one particular supplement towards the end of this class that can support the patient's methylation and in that process, right? It's a simple and affordable, so that's something that like a quick solution for some of those patients, right? But we have to know. If we don't know, then our patient goes home and then they slowly lose function and develop complications. So that's something that we never want for our patients or our community members, right? So now we understand the fundamentals. Now let's go in and go a little bit deeper into the more functional medicine take into it, right? So of course, a lot of the stuff we talk about is our functional medicine, right? The environment, the nutrition, diet, all of that stuff. But there's a major part that we talk a lot about, which is our gut health. And essentially the gut microbiome is also playing a central role in regulating our methylation capacity, which is really interesting. So it does it directly, it does it indirectly, but most of it is really through key metabolites that it produces that are essential for DNA methylation and other methylation reactions. So one of them is some species in our gut bacteria produce certain vitamins, such as certain B vitamins. For example, Bifidobacterium, Lactobacillus, some species can actually synthesize folate and other B vitamins. And this is really important because they're essential cofactors in the methylation process. The second thing is that if you have sufficient amount of the beneficial bacteria in your gut and you're providing them with the essential foods that they need to ferment and create the metabolites, which are the, let's say, short-chain fatty acids, you can actually, some of those like butyrate, for example, acetate, are key epigenetic modulators, right? So butyrate, for example, function as a histone deacetylase inhibitor, which we're not going to get into too much, but essentially promotes genes expression that is linked to cellular repair and anti-inflammatory signals. So if you have sufficient amount of butyrate, right, which you can test, there are specific tests like GI360 that can actually tell you how much do you have of the short-chain fatty acid in your gut, how much butyrate, how much of some of these beneficial bacteria, right? There's multiple markers in that lab, but you can take, like, if you're experienced in functional medicine, as we train you, you take a 2 to 3 minutes look at this test, and you can already tell the patient, okay, this is what's going on with you, and this is why your body is behaving in that specific way that it's behaving, right? Because you can see the levels of all these epigenetic regulators. And so that's another example that I want to give. And the last example that I want to give is what we refer to as gut methylation axis, which is essentially if your patient have, for example, dysbiosis, which means that they have the wrong type of bacteria or certain bacterial overgrowth, what will happen is they will not have a sufficient amount of these beneficial short-chain fatty acids, but also on the other side, they can have what we call leaky gut or endotoxemia, which essentially increases the epigenetic expression of genes of inflammation, right? And that's definitely something that we don't want, because while some of these bacterial metabolites might not cross, they could cross to the bloodstream, but not to our brain. The cytokine expression, the inflammatory cytokines, could cross into our brain, and that could impact your mood, that can impact your patient's brain function. So there's a lot of damage slowly, but over years that can take place, right? And that's why as providers, we always want to look at the whole picture, right? So, and that also exactly the reason why when you're in a program, our community members, for example, they get paid for their services really well, typically between $200 to $850 per session. And that's because they provide answers to their patients that go way beyond what a primary care provider typically does, right? So it's very valuable for patients to learn that. So let's do a quick, now that we talked about the gut methylation axis, let's do a quick pop quiz just to kind of get us our thinking caps on. So the question is, what can result from impaired microbial folate production or absorption, right? So if you have, whatever it is, you have some sort of imbalance in your gut bacteria and it impairs your production of folate, right? Option number A is enhanced DNA repair and reduced inflammation. Option B is increased methylation efficiency. Option C is altered gene expression and high susceptibility for inflammation or metabolic disorders. And D, decreased SAMI breakdown and elevated serotonin. So what is the answer? I'm going to give you a few seconds. Okay, so the answer is C. So as we mentioned, if your bacterial, this was just the first more simplified example. If your patient has bacterial imbalances, then it could impact they could be more highly susceptible to expressing genes of inflammation, metabolic disorders, and as I mentioned, homocysteine processing of excess homocysteine in the body requires folate as part of other B vitamins, right? If they don't have that, that can increase the risk of all sorts of other diseases. So that's kind of like when we now are starting to really get into more of what it is that the unique services that you're offering your patients versus what others are offering, right? So Dr. Esha, I know that you have years of experience with communicating with patients about, how is this different? So
Yeah. There are plenty of differences, right, with the functional model of medicine and conventional model of medicine. And this epigenetic methylation conversation is so important because it's usually the only place where patients have access to this conversation, right? And so when we're thinking about the difference, just overview of the functional medicine kind of umbrella and then the kind of conventional medicine umbrella. Let's take a look at this chart that we have for you. So you'll see the kind of standard of care conventional model, and then you'll see the functional medicine model, right? So you see what it's focused on, the typical treatment methods, and then the long-term impacts of each of these two systems of medicine. Conventional medicine often follows a linear model, right? So evaluate, diagnose, match the drug to the symptoms or disease markers. It's pretty much an algorithm. If this doesn't work, go here next. A doesn't work, then we go to B. B doesn't work, we go to C, then we refer out. And it's pretty much algorithmic and linear. And so while effective for acute care, the model typically overlooks deeper biochemical individuality, especially what we're talking about tonight, methylation function, which influences pretty much everything from detoxification to neurotransmitter synthesis to inflammation and gene expression. In contrast, functional and integrative medicine takes a more systems-based approach. So we're looking for underlying dysfunctions. We're looking for, is there gut dysbiosis? We're looking to remove triggers. Does this person have a lot of mold in their environment? We're looking to restore balance through lifestyle, nutrition, and targeted therapeutics, which may include nutraceuticals or supplements. And sometimes it doesn't include that. From this perspective, methylation is not just a lab marker that we're just looking to assess and just treat with the supplement per se, but it's a dynamic process influenced by nutrient availability, your folate, your B12, your B6, your betaine, your gut microbiome, the toxin burden, and the stress response, which a lot of those concepts are never even discussed in any doctor's office. I could say I've been going to the doctors I just have my insurance and I go see my regular doctors every now and then, and just to check in. And I never have a conversation about nutrition, never run a lab on nutrition, never gut health, never toxic burden. And it's the same for my patients, right? So that's kind of why we do functional medicine, is to offer all of these nuanced epigenetic methylation perspectives. So these functional medicine practitioners, like you, like myself, we assess these interconnected pathways to optimize methylation pathways, methylation capacity, rather than simply treating downstream symptoms. So by addressing methylation through personalized nutrition, microbiome support, cofactor replenishment, we can help regulate gene expression, improve detoxification efficiency, and enhance overall resilience for our patients. And these are outcomes that like I mentioned, the conventional one size fits all approach just typically misses. So just a little bit of insight into functional medicine, which I'm sure you all know a little bit about or a lot about, right? So functional medicine approaches disease from multiple aspects. So one, we're doing comprehensive evaluations. We're looking at deep systems level assessments. These include laboratory testing, genetic profiling, lifestyle analysis to uncover underlying factors affecting methylation, redox balance, and overall metabolic function. I know for me, like I have a huge questionnaire for patients and they're like, I've never answered a question about where I live. And, if I live near a factory or, there are questions that we just ask that are never asked or never thought about, reducing or removing exposures. That's another huge component to functional medicine. Once we identify underlying contributors, we're thinking, how can we minimize or eliminate the exposure sources that can impair methylation and cellular detoxification? So like I mentioned, these could be environmental toxins, so mold, these can be heavy metals, these can be poor dietary patterns, lifestyle stressors, and so forth. We think about applying integrative therapeutics. So functional medicine is going to leverage targeted nutrition, botanicals, supplemental interventions to restore, in the context of this conversation, to restore methylation capacity and this balance in the system. So a lot of the strategies around that include like the B vitamins. They're really important for methylation processes. Your folate, your B12, your B6, your choline, your betaine, and then supporting the cofactor dependent enzymes, which may look like a whole different set of nutrients. And then the last piece is just kind of reinforcing those foundational health factors. So helping patients to sustain these improvements in their methylation pathways by focusing on lifestyle optimization. So it's a lifestyle change. It's not just add this supplement or add this pill, you can keep doing what you're doing. It's actually a lifestyle change we're trying to influence for our patient in our patients' lives. And so we guide our patients using evidence-informed strategies to enhance all of these parameters. So that's just a little bit of how functional medicine is different than conventional care, which is pretty big in my opinion. So let's do another pop quiz, right? Why is methylation considered more than just a lab marker in functional medicine? A, because it's only relevant for rare genetic disorders. B, because it reflects dynamic processes that can affect detoxification, neurotransmitters, gene expression, and inflammation. C, because conventional medicine already fully addresses it. D, because it cannot be influenced by diet or lifestyle. And lastly, I'll give you a few seconds to answer that one. The answer is B, because it reflects dynamic processes affecting detoxification, neurotransmitter synthesis, inflammation, and gene expression. All right. So, Dr. Tall, I had this teacher once in school when I was in undergrad, and he'd always say to me, if you don't know the answer to the quiz, you should always pick C. And every time I do a pop quiz, I think of him. And the answer C here is completely wrong. So just thinking we got the right one. It's affecting dynamic processes, detoxification, neurotransmitters, gene expression. So functional medicine is really important for even just this concept alone. Oh, I can't hear you.
And I think that if you have only 3 options, then C will probably get you there a third of the time. So it might not be as bad. It might not be too bad, right? But it's it's really interesting because a lot of this concept is there. We some refer to them as holistic, but I would say the more medical term is probably precision medicine.
Yeah, I like that.
Right? Which essentially it's instead of the more pill for every ill approach, right? Which is you got diabetes, here's metformin, go home, right? We'll see you in a few months. It's more of like you have diabetes, you're already taking the drug to manage their condition. Now let's figure out what's causing that, right? Let's figure out what is triggering those genes of dysfunction, of diabetes, or whatever it is, right? And while we sometimes get asked by practitioners, like, how long would it take me to learn all of these different epigenetic influences, right? From what our immune system, what causes the dysfunction to our immune system and autoimmune conditions, or immune deficiency, or endocrine disorders, or cardiovascular, or neurological. There's a lot of different systems, right, that we look into. Of course, we dive a lot in the first probably 2 or 3 months into some of the major epigenetics, right? Like the gut, the environment that we're exposed to, what we're eating, what does that do to us? We're looking at cellular function, mitochondrial energy production. So we look at a lot of different factors. But interestingly, a lot of people just sometimes ask us practitioners, like, how long would it take me to apply this? Like, I have patients that are sick right now, right? Some of them are not getting any better, right? Or some of them keep coming back as they struggle. So I don't have years to spend on learning all of this, while if there's something that I can do to help them now, that would be amazing, right? That would be beneficial for not just for them, because that's what we do it, to help them to transform their lives and their family lives, but also for you as a practitioner to develop your skills and develop your practice if you want. So we have, in the last few years, I'd say probably last 6 or 7 years, been working on different tools to allow practitioners to quickly apply functional medicine in their practices. And that's including impacting their methylations, or the detox processes, their endocrine neurological function. So I wanted to share with you the functional and integrative flow. And this is really after coaching hundreds of practitioners to do that. We now can summarize the whole process in simple 4 steps that anybody can do. Literally any healthcare practitioner, and I'm saying any healthcare practitioner can do it. I know, because we've done that with pretty much any type of professional healthcare practitioner. And these are the 4 steps. So the first step is the review. This is where the patient comes to see you. You look at their story, you look at their medical history, you look at their lifestyle, occupation, major concerns, right? Now, the second step, we go into identifying, right? So identifying, what is it? What are the factors that are contributing or triggering to the dysfunction? In today's conversation, for example, we give a few examples on what factors can impact our methylation, right? That's what we refer to as epigenetic, right? And so you don't need to have years of studying and seeing patients experience with functional medicine to apply this. We actually created this functional health evaluation tool that you give to your patient. The patient fills it up before they show up for the next time, or they just upload it to the secure portal. And within pretty much 3 to 5 minutes, you can already look at the score and signs and symptoms of each one of those factors or categories, right? So if the patient comes to see you and they're like, here's the form that I filled up, and you look at it and you're like, oh, okay, so you got a lot of signs and symptoms of mitochondrial dysfunction or environmental exposure or certain nutritional deficiencies or exposure to endocrine disruptors or whatever it is, right? You can very quickly identify what are the top 2 things or 3 things that you can provide recommendations about and make the biggest difference for the patient that is in front of you. And for the last few years, for several years, the practitioners in my practice have used it, the physicians, nurse practitioner, the nutritionist, and it was very, very successful because one, it saved us a lot of time on trying to identify what it is and asking a million and one questions. Second, it almost like a funnel. It takes all of the patient's experience and exposures and risk factors and everything and kind of funnels it down to like the essence of it. So you can go into the advanced and clinical functional medicine portal when you're in the program and just download it. You get a lifetime license to use this tool. So use it because it is game changer. It's a game changer, right? Now that you have the top 2 or 3 things that you want to work on, let's move to step number 3, and that's creating a plan. Now, creating a plan used to take a long time, even for somebody who is experienced, right? I went through 3 different functional medicine programs. I went through multiple integrative and nutritional and herbal medicine program. And I remember myself sitting there, and after I would see a patient and I would know, okay, this is the 2 things I want to work on, or they also have diabetes and also have, joint pain that I want to help them with. And I would have multiple books that are open, herbology books and supplements, and I would have Dr. Gabby's nutritional medicine book, and I would have this, and I would sit there to build a protocol. And it was very tedious, very time consuming, and it's not really practical for most practitioners, especially when you're getting busier, right? So this is the reason why we developed the Quick Start Guide. Quick Start Guide essentially has very specific protocols for each one of the root causes. So the patient, you just found out the patient has high exposure to heavy metals. Okay, they have signs and symptoms. Maybe you can see it on the form that they're eating a lot of canned food or lots of seafood or whatever it is. They get the signs and symptoms. Okay, great. We can, the Quick Start Guide, you want to use to see which functional labs you might consider for this lab to get more data. It also tells you what are the specific protocols, functional medicine protocols you can use, and which clinical studies they're done. So it's all evidence-based. What is the dosage you want to look into, and which supplements it's found, right? Now, the patients still also have other factors, other things they're concerned about. They have joint pain every day. Maybe they're feeling tired. Maybe they have headaches. Maybe they have whatever it is. We developed together with a technology company a phone app, functional medicine phone app, that has all the treatment protocols. So, for example, all you got to do is just type in headaches, and it pulls up all the treatment protocols. You type in type 2 diabetes, arthritis, joint pain, and it gives you the very specific protocols. So essentially, you can build a whole protocol in 5 minutes, right? Within just a few minutes, you get all the answers to what do I do with a patient, what type of supplements, what type of protocols, like everything is there for you, right? Now that you have the health plan, you provide the value for the patient that no other practice in your area can provide for them, right? And it's all evidence-based, right? And you're giving them exactly what's going. You educate them about what's going on and how to do that, right? And that's the last phase, which is providing evidence-based strategies to support healthier function and well-being. And that's how a lot of physicians in our community are doing it. That's how a lot of nurse practitioners and even nurses who are doing health education sessions with patients, right? So again, none of this is to replace primary care. We're not diagnosing diseases. We're not prescribing medication, right? This is purely focus on the functional and integrative approach of really focusing on identifying what's causing the dysfunction, removing it, and working towards healthier function, right? That's that concept of precision medicine. So what's really cool about this is that all of those tools are included now in our program, right? So when you look at the advanced and clinical functional nutrition medicine practitioner, which we have in our next picture, you can see that it includes, we focus on the clinical application. In the first 3 to 4 months, we teach you pretty much all of these different major epigenetic factors, root causes, but we give you the evaluation tool and your clinical guide and a phone app from your first month in the program. So literally, we get you right into it, and we are here with you. So we have amazing mentors such as Dr. Esha, Dr. Chill, Dr. Kim, to help you utilize everything, right? So you can do case studies and see, you can use the evaluation tool on yourself. That's what I did. And I used it on a family member that needed help. I saw what needs to be improved, optimized, and then I worked on it. And it's kind of like encapsulating years and years and years of functional integrative medicine experience and knowledge and multiple books and protocols and studies from PubMed, all into like simple tools that can help you get started right away. And of course, it is self-paced, so we can help you around your schedule. And there's also live and on-demand workshops, like classes like we're doing right now, but specific workshops on building your first functional medicine program for your community, or the clinical summit that is coming up. There's a new clinical summit that is coming up. So if you're interested in learning more about these tools, reach out to our team. We can help you get started. And of course, if you are already in our functional and advanced program, then make sure to get the evaluation tool and clinical guides and book your consultation, book your coaching, because we're going to show you how to use all of those tools. And if you don't have a practice yet, that's okay. That's perfectly fine. I started on myself, and then I came up with my mentor, and we did he showed me how to use all those tools. And then I found a family member that needed help, and then I had them fill up the evaluation tool, and I came in, and we have a HIPAA compliant portal, so everything is very discreet and secure. And so we want to help you apply this, not in 6 months, not in a year. There's people that need you right now, probably in your community, maybe in your family, maybe friends. Let's help them. Let's help them while you develop that functional medicine muscle. So we're going to finish up with one particular supplement that can support methylation. And so Dr. Esha, take us into one of those recommendations.
So the last thing we're going to talk about is a supplement, and just to piggyback on what Dr. Tall mentioned, the one-on-one case studies, there's a no judgment zone, right? So it doesn't matter how little you think you might know or how much you might know. We're just here to help you. We can help you go over labs that you may need help support with, or just kind of ideas for a case. So it's a judgment-free zone. Sign up and kind of get the help you need. So, okay, supplement. So supporting methylation, this entire conversation tonight has been about methylation and kind of these epigenetic pathways. So supporting methylation is a key strategy for optimizing overall health, especially in our patients with multiple chronic issues, metabolic issues, neurological components, and so forth. These biochemical processes influence everything, like we mentioned before: detoxification, gene expression, cardiovascular function. We're going to show you an image of a supplement by Metagenics. It's called Methyl Care. This is a supplement that's going to blend different nutrients: folate, NAC, vitamin B6, B12, betaine, HCl, to provide targeted support for your methylation pathways. Folate, particularly in its active forms, is critical for providing methyl groups that fuel DNA and neurotransmitter methylation. Vitamin B6 and B12 acting as cofactors in these reactions, helping to convert homocysteine into methionine, which is a key step in the methylation pathway or cycle. Then you have your betaine, HCl, which is also going to donate a methyl group and support liver function, which is essential for detoxification processes. You have your NAC, which is going to complement this entire blend by supporting glutathione production, which is one one of our body's most potent, which is our body's most potent antioxidant. And then glutathione works hand in hand with methylation pathways to help neutralize toxins and reduce oxidative stress. So by combining these nutrients, this supplement not only can support methylation efficiency, but also detoxification, cardiovascular health, antioxidant systems, and neurotransmitter balance. Regular nutritional support for methylation can help our patients with cellular, genetic stability, improving energy, supporting healthy immune and cognitive function. And then, while dietary intake of these nutrients is important, sometimes they need a little bit more. They need a targeted supplement to ensure the body actually has what it needs and has a sufficient amount of it to optimize these critical pathways. So I think somebody mentions around. Is there a question around NAC, Dr. Tall? I think I just saw that pop up.
Check why NAC has a short life. Oh, okay. Why NAC? So NAC. I'll answer while I'll let Dr. Esha also kind of think about it for a little bit. Maybe she's got a different perspective than I do. But NAC has a short life, but what's interesting about NAC is that it has multiple function. And for anybody wondering, NAC is N-acetylcysteine. And the N-acetylcysteine, when you take it, it does multiple things. One, it supports detoxification, which is really important. Second, it boosts or upregulates our master antioxidant, which is glutathione. So in the advanced practice, functional integrative medicine, or some of the advanced modules, we talk a lot about the how to use and what dosages, and there's protocols specifically more for helping a patient to eliminate certain chemicals from the body. There's also certain protocols to, if the patient has, like, let's say, an autoimmune condition, and we know that there's ongoing damage that is happening in the body, right? So upregulating the master antioxidant glutathione could be one way to reduce or minimize the damage, the cellular damage, right? There's other functions for NAC that we can talk a lot about NAC, but those are a few of the ones that are important. And NAC also, really interestingly, NAC also impact neurotransmitters. There was one particular study that talked about NAC for patients with addiction, and they found that there was a reduction in the cravings, let's call it the craving for the addictive behavior, just by taking NAC. So NAC does impact our epigenetic. It just depends on the dosage and depends on for what you're taking it, right? Dr. Esha, did you want to mention anything beyond that?
No, I mean, I double agree with what you said. I think also on top of that, I'd say it's one of the most evidence-based ways to increase your glutathione. So for me, that's just kind of a simple solution, and like there's a ton of evidence to support it. And I guess you could try, offering liposomal glutathione, but I think also it comes down to formulating these supplements together and kind of how all these things interact. And so I don't know if they would do like a liposomal methyl product that has maybe a glutathione. You could check for that too. But there are also issues with bioavailability of glutathione, right? So I do think that NAC orally has been shown time and time again to be a consistent deliverer or precursor, if you will, to the glutathione pathway. So
yes, exactly. And like I really like the comment. NAC has a short half-life, and sometimes we just got to take a look at the pros and cons of each individual compound. So, for example, NAC is very affordable, right? And when combined with the specific vitamins like B6, B12, all of that stuff, right? It's there to support methylation, right? It's there to support certain processes, right? Reduce oxidative stress and cellular damage. You could try to go with Dr. Esha, for example, mentioned the liposomal glutathione, but one, it is very expensive. So, I think some patients would have some might have some inner resistance to buy one supplement with one compound that can cost them between $60 to $100 per 1 month, right? And from what we're seeing in the studies, I mean, NAC is quite effective, and you can find a good NAC by several companies like Pure Encapsulation or Now Foods for like $15, right?
Mm-hmm.
And so, yes, it has a short half-life. So what we typically would look at is taking it in the morning, taking it in the evening.
Yeah, a lot of times it's dosed throughout the day as well,
Yes.
in different protocols. So
Yes, exactly. So when we look at all our recommendations or consideration, we always look at what has the most amount of studies, what's also not too expensive for our patients, because we want to make it as affordable, right? Their biggest expense is really going to be coming to see you, because you're a professional that will give them many of the answers they're not going to get anywhere else. Everything else, the supplements, the labs, everything else, I always used to try to make it as affordable for my patients as possible, or find them ways to get it more affordable, right?
Mm-hmm.
So let me see if we have any other questions before we finish up for the day. There's mentioning about how effective at raising CD4 CD8 cells. So I'm not sure is a question about more specifically NAC. Okay. Oh, okay. So they put here about NAC. Yes. So NAC is really interesting. I already mentioned that it's a precursor for glutathione. And glutathione is not just to reduce oxidative stress and cellular damage. It also has a role in supporting T cell proliferation. So, for example, there are some really interesting studies about NAC supporting immune function. For example, one of them was in patients with HIV positive individuals, and it helped increase the numbers of CD4 plus cells. So yeah, there are different really interesting studies. There's another one that NAC was able to improve the natural killer cells activity, right? Mm-hmm. So again, that could be helpful if your patient is going through a has viral infection. This is why some supplements with that are so-called immune supporting, and you see a lot of those during COVID pop up on Amazon. A lot of them will include NAC as well, because it helps. Mm-hmm.
Yeah, I think also, like, when I think about patients that I'm seeing, or I'm trying to rev up their immune system or support their immune cells, I'm probably, using NAC along with a few other things as well. So it's usually not used in silo or in isolation, but it can be a good supportive agent in that regard.
Exactly. So as we mentioned with everything here, all our recommendations, right? It's not typically, yes, the studies we look at is like one specific compound, get this specific results, let's say within 3 months or 4 months, right? But let's call it the real magic, right? Happens when you address the root cause with 1, 2, or 3 supplements. You have at least 1 or 2 dietary recommendations. You have maybe 1 lifestyle recommendation. You kind of package it all together, or provide slowly, right? Every 2 weeks, 1 recommendation or 2 recommendations. And then of course you also address the root causes, you address the physiological imbalance, right? So beyond everything we talked about today, if the patient also has, for example, insulin resistance, I might also pick 1 specific protocol that can specifically support the insulin sensitivity, contribute to insulin sensitivity, right? So we always want to have a very comprehensive approach to look at the root cause and the physiological imbalance that is happening right now, because otherwise the patient, gonna keep struggling, right? If they got joint pain and you're sitting there and you're like, listen, we're gonna use functional medicine in the next 6 months, we'll work on the root cause and all of that stuff. They're like, what? But I'm suffering now. Like, what can you give me now for my pain, right? So okay, so let's talk about the root causes. And at the end of the visit, it's like, okay, here's one or two herbal or nutritional compounds that can help you reduce inflammation, right? Start taking it, right, as soon as you can. So we always have to think about what our patients are also experiencing and not just the root cause, right? So, okay, so there's a question. If I'm already a student in the program, how can I get access to the app? So the app, so that's something you can reach out to the team, the team of admins, and then they'll facilitate that from there. I know that from what I've understood, anybody that enrolled from August of 2024 will get the professional account. And then there is a version that we open to everybody, which is has the herb drug interaction, which is really cool. There's also the drug induced nutritional depletion. So if your patient taking metformin, just type it in and it pops up like what nutrients it might cause depletion of. And then there's lots of articles and videos, mini articles and videos that we push every week. New ones that you can't find anywhere else. But the idea is that's open to all of our community members. But reach out to the team and they'll get you more information about that. So really appreciate everybody. And I wanted to, first of all, big thanks to Dr. Esha for being here.
Thank you for having me.
Yeah, I feel like this was great listening to your experience and all these cool studies that we talked about. I want to thank our media team and Jacob for helping us to facilitating this and allowing us to be with you wherever you are. And then I also want to thank each one of you for being here, really for taking the time and effort to advance your skills. This is something that, based on my 20 years experience using integrative or functional medicine, I can tell you you're going to change a lot of patients' lives, like really change, like transform. And that will be impacting also their relationships and their own family member and the wellness of your community as a whole, right? So one patient at a time, one family at a time, you make your impact. And for that, I'm really grateful that you're here. Take everything that we're teaching you and see where would that apply? Where can I apply it from already tomorrow? Which one of my patients I can start utilizing some of these principles? And when you're in the program, what I want you to do, the first thing, I'm going to give you a little bit of homework, even though nobody likes to use that word, right? But really, what I want you to do, the next step is to connect with Dr. Esha and Dr. Kim. They're amazing. They can work with you one-on-one, show you how to use the clinical evaluation tool and the clinical guide. And that's included in your program, right? So utilize that. Don't wait. You don't need to wait until I'm like, oh, well, will I feel worthy of functional medicine? Like, don't wait for that. Just start applying with Dr. Esha and Dr. Kim. They're very experienced. They know what to do. They'll help you take it from there. So I want to thank everybody for being here, and take care for now and have a good evening. And I did see a question here about the practice building. So I wanted to just mention that since we're at the end of the class. Let's show the picture of the practice accelerator. So we had a few members reaching out and asking us about the practice accelerator. So this program, we just opened the next session of the practice accelerator. In November, we're doing the live workshops for get 5 ways to get patients for free. Fill up your schedule. The second is going to be how to properly do a consultation to enroll more patients into your practice. How to start on a small budget from home without needing to have an office space, or all you need, you can do it virtually. All you need is literally a computer and internet. And the practice accelerator also comes with HIPAA compliant software. So all your marketing, scheduler, your website, your phone, secure phone and email. So everything is included, which is really cool. So you don't have to worry about like, what software do I use? How do I talk to my patients? How do I this? How do I, what's going to continue the conversation? Like, everything is automated. We help you set it up. We have a technical team that sets up that up for you. And then so everything is included, and mentorship and classes that are more specific towards how can you get started, build your successful practice. Me and Dr. Chill has built three brick and mortar practices, one in Arizona, one in California, and then he built another one in partnership. And then he built online programs. So if you want to do virtual, that's also possible. And I also have years of experience with doing so. So we're taking everything that our mentors taught us, all the systems that we have built, all the systems that we purchased with the academy, and we're giving it all to you. So if you want an accelerated path towards building a successful practice, increasing your income, reach out to us. We got more information for you. And this month we're waiving for in October, we're waiving the setup fee. So that can save you over $3,000 just by doing that. So we made it very simple, just a monthly payment, and you get access to everything. So thank you again. Reach out to our team if you got more questions, and American Academy of Functional Health. And I hope you all have a blessed evening, and take care for now.